Welcome to Legalized Negligence. This morning, I'm going to do the second part of the little short series I'm doing on the Department of Health and AHCA and how they do not serve the people in protecting them from negligent doctors and nurses. And I will be including this podcast in my email to Senator Yarborough later this afternoon, along with part one that I did yesterday. He had asked that people send him information to help him figure out a way to thread the needle. And as I asserted yesterday, I don't think you need to be rethreading the same needle. I think you need to find a new needle to thread, because this is 34 years now. The people have had rights denied. He admitted at the beginning of the Senate Judiciary Committee that what has happened to these people who fell under subsection 8 of statute 768.21 is an injustice. And if it's an injustice, then that means the Senate and the House have, and the governor and the judiciary have an obligation, a duty to right that wrong. And a duty is a lot different than a right. You can have a right to do something and choose not to exercise it. But when you have a duty to do something, you can't make a decision to not do it. You're required to do it. It's your obligation to do it. I have the right to free speech, but I could choose whether or not I want to say something. But if I have a duty as the personal representative of my mother's estate to do something by law, I can't choose to do it or not do it. I have to do it. And the government's responsibility is the exact same. You have a duty to protect the rights of the citizens of the state of Florida. So I'm going to do what I did yesterday. I picked two more videos that I had in my archive, and I could do this all day long. I mean, there's so much out there that if Senator Yarborough had the time, I could keep him at his computer for a week watching these videos about what's going on in Florida with the malpractice, with the Department of Health covering for doctors and nurses, with the misinformation that the insurance companies have provided to him. But I'm going to let these two videos speak for themselves. The first one's 6 minutes, and the second one is about 2.5 minutes. So I will be quiet and let the news reports tell the story.
From advances in medicine to medical worries, more than a dozen doctors lost their license to practice medicine in Florida last year.
It is the ultimate punishment when a doctor does wrong. But tonight, the Contact 5 investigators discovered doctors with tainted pasts who are still treating patients. Here's Katie LeGrone. Kelly, we found doctors who have had their license taken away are not automatically banned from treating patients. They are dedicated to comforting the sick, aiding the diseased, and saving lives.
The overwhelming majority of physicians in this state are wonderful doctors.
But for a small minority,
it's always going to be a problem.
A problem the Contact 5 investigators went undercover and came face to face with when we found doctors deemed too dangerous to practice in other states.
I don't think you can roll the dice with people's lives.
Are still licensed to treat patients here in Florida.
But if they're incompetent in Virginia or Delaware or New York, why would anybody think they're competent here in Florida?
It was supposed to be a couple-hour procedure.
Michael Hannon is a widow with a warning.
There's something wrong with the system.
Janet Hannon was 57 years old and preparing for her son's wedding when she decided to undergo a series of nip and tucks inside this Maryland clinic.
Yeah, so it's not a day that I don't have a regret about it.
What was supposed to be a 6-hour operation lasted more than 10. 2 days later,
I came back and to check on her, and her body was ice cold. She was gone.
An administrative law judge ruled Janet's surgeon, Dr. Oscar Ramirez, violated several medical rules during and after Janet's surgery. Her family would later learn just 5 months earlier, another patient also died following a Ramirez procedure.
Had appropriate action been taken then, my sons would still have their mother. Sometimes, even now, it's not real. You have to pinch yourself and say, what happened?
Last summer, 6 years after Janet's death,
The Maryland Health Board finally revoked Ramirez's medical license for, quote, failing to meet the standards of quality medical care. But look up Dr. Oscar Ramirez in Florida, and you'll find a record that's clean, a license that's clear. And yes, that's him treating patients right here in South Florida.
What makes you think that his patients should trust him practicing here?
It's not a case where you just because somebody else revoked it, you just revoke them the next day.
Cardiologist Dr. Zachariah serves on Florida's medical board, which issues and revokes Florida doctor licenses. He says just because a doctor's license is revoked in one state doesn't mean it's automatically taken away here.
It has to go through the due process.
Last year, while it took the state board an average of 2 months to issue a doctor a new license, it took them on average more than a year to take a license away. It seems like this due process favors the doctors.
I don't think so. In the reality, a due process is something good for which both protects the public and the public and the doctor. You have to be fair to both sides.
West Palm Beach dermatologist and former state medical board member Dr. Stephen Rosenberg has been frustrated with the system for years.
Unfortunately, it's very difficult sometimes to revoke those licenses because of the legal opportunities they avail themselves of.
Case in point, Mark Geyer. He was found misdiagnosing autistic children. He lost his medical license in at least 4 states. And in Florida, he has a pending case. Yet his license here remains clear and active.
And therein lies the problem. It can take 5 or 6 years for a case to progress.
Carol Gentry is editor of Health News Florida.
There are a few rogues, and they get away with it for years, and they keep popping up.
Remember, in Oscar Ramirez's case, it took Maryland 6 years after the deaths of 2 patients before his license was revoked. So where did we find him still treating patients? At this cosmetic surgery center in Weston.
Do you feel like you're a risk to the public practicing as a physician?
I practice with the highest standard of care. My surgery center was a state-of-the-art facility with all the safety issues for patients.
Ramirez maintains his patient deaths in Maryland were not the result of his surgeries.
I don't believe that was a risk.
He recently lost his appeal in Maryland, but plans to fight to keep his license here in Florida, where a complaint is on file.
No system is perfect. You can always improve, but I think the system that we in Florida works very well.
And all I can think of is, suppose another woman walks into that center and ends up the same way my mom did. And what happens to that family?
Doctors with revoked licenses are required by law to report that action in the state they move to. In the case we profiled, Oscar Ramirez did do just that. Now, there is a national data bank that tracks doctor discipline nationwide. And while it is designed to protect consumers, it is not available to the public. Kelly Michael.
Is there a way for patients to be sure that they know everything they need to know about a doctor's past?
A good question with a not so good answer. I mean, the bottom line is there's really no foolproof way to know exactly your doctor's past if they've come from another state. Now, of course, you can find out where they've come from and do some of the research yourself. Now, on the other hand, the state of Florida recognizes that this is a problem. As a result, they are implementing new policies as we speak to move these cases faster in an attempt to help consumers. An emergency suspension unit has been created with the sole purpose of stopping doctors with questionable pasts from practicing at least while their case is moving through the system. That is one way to address this issue, but it is a problem.
Katie, thank you very much. It's something we'll certainly continue to follow as this winds its way through the system.
All right, that was the first video. The next one is shorter than that, so just bear with me for about another 2.5 minutes, and then I'll share my thoughts.
And we begin here tonight with the follow-up to that I-Team investigation exposing hundreds of Florida doctors still treating patients after multiple malpractice settlements. I-Team investigator Adam Walser breaking this story, and tonight he takes his findings to a medical ethics expert, revealing just how far this troubling trend goes.
A USF professor who trains future doctors tells me there are warning signs a patient should look for before choosing a doctor or a hospital.
When we look at going to see our physicians, we expect that they're providing us quality care.
Medical ethics professor Catherine Drabiak reacting to our investigation, which uncovered at least 120 Florida doctors racked up 3 or more malpractice claims over the past decade. Many still practicing, even though voters passed a constitutional amendment in 2004 to revoke a doctor's license after 3 malpractice convictions.
It could have gotten rid of a lot of physicians that were making mistakes, particularly egregious mistakes.
But the I-Team has uncovered only 2 doctors lost their license under the so-called 3 strikes law, because most cases are settled before trial.
When does it become a red flag when you see these multiple settlements?
When there's multiple malpractice suits over and over again that start to show a pattern of conduct.
The I-Team also found a complaint against a local doctor led the state to open an investigation into Palms of Pasadena Hospital. Investigators found the hospital placed patients in ongoing immediate jeopardy, providing no evidence of the competence to provide quality medical care for its 466 doctors and staff.
Who is it that they're hiring to make sure that this person is not only qualified, but is providing effective and safe care for their patients that come into their facility?
And if they're not doing that, then the patient potentially is at risk.
The patient is potentially at risk, exactly.
I'm I-Team investigator Adam Walser taking action for you.
There's a lot to know about this, and tonight we're going further, showing you exactly how to find out what malpractice claims your doctor has paid. First, you want to go to abcactionnews.com/I-Team. There's the link at the bottom of this article to the Office of Insurance Regulation, and then you'll see this page. Fill out as much information on your doctor as you can, like name and license number. That's very important. And then the next page here will give you the claims that people have filled against that doctor. You can find out what the patient's injuries were and how the claim was eventually settled.
All right, so there you have it.
The final moments of a North Las Vegas pastor's life, captured on video, is now revealed in a newly filed wrongful death lawsuit. This is the woman accused of killing the pastor, his next-door neighbor, Joe Junio. She is now charged with murder, attempted murder, and child.
Sorry about that. Sorry, sometimes it's hard to run all this stuff and talk at the same time when you're by yourself. The point that I'd like to make about all this is these doctors and nurses are still practicing. Even when they have a complaint filed against them, it can take years. And that's what we're asking the legislature to do something about. I'll address my final comments here directly to Senator Yarborough because he asked for input, and I've sent him emails. I have provided the research that I've done. I've given him the names of the law review articles, the task force study, the books that I've read, the research papers that have been written by lawyers and doctors. I've provided all of that to him. And as attachments and emails, and I'm hoping he read them. He said and I believe him. I believe he's really trying. I also know that he's probably inundated with a lot of work. But when you're limited, if you're asking for the information and I supply it, then I don't know what else to do. But so I'm going to send you this video, this podcast, and let you watch it. The big thing that I would like to know is when is the legislature going to do something about the Department of Health and AHCA? As I said yesterday, in listening to an hour and 48 minutes worth of the judiciary hearing meeting that took place last week, I didn't hear one person bring up the fact that the Department of Health and AHCA are not serving the people. All they do is protect doctors and hospitals. And if they do let a case go through, like in Sabrina Davis's dad's case, it was so egregious that they couldn't turn their back on it a first-year medical student would have known that Mr. Davis had a blood clot, and he lay there for days without them taking care of it. And I think that, you know, the Department of Health kind of like, well, we can't brush this one under the rug. That Sabrina girl has just been too vocal, so we can't shut her up, so we better do something. And they fined him $7,500, and he's still practicing. And Sabrina shared with Travis and I the other day that I believe she said it was the day before his hearing with the Department of Medicine or the Board of Medicine. She discovered that he had gone into her dad's record and made some kind of entry and called it continuity of care. Now, I don't remember the exact dates, but I want to say it was a year or two after Sabrina's dad died, and this doctor still is going in and making alterations to the medical record. See, we can't do that. We can't go in there and make it say something that we want it to say. You know, I firmly believe, and I challenge you, Senator Yarborough, to investigate the Department of Health and AHCA. I think those two agencies need to be turned upside down. I think they need to be run out into the public light where the sun shines on them, where we can see what they've been doing behind those closed locked chambers that they operate in, where they treat the citizens of Florida as though there are overlords. And I think it's time to do something about those two administrative agencies. I don't believe they protect the people. If they issue the license and revoke license, then why are these reporters doing news stories about less than 2% of doctors are causing more than 50% of the malpractice payouts, and of that less than 2%, only 1 in 7 ever get disciplined? This makes no sense to me. That agency is not a functioning agency to make sure that the people's rights and lives are protected when they go seek medical help. So I will issue that challenge to you. I would love to see you turn those two departments inside out and make them show the legislature that they are doing what the legislative intent was when those agencies were created. You know, I'll say it one more time, even though I've said it 1,000 times. You know, it's quality over quantity that we want. You can import all of the bad doctors from the other 49 states, and it's probably worse doing that than it is to have fewer good doctors actually practicing. If your numbers of doctors are too low, but those doctors are good doctors, that's better than bringing in a whole bunch of doctors from other states who have had their licenses revoked and who have malpractice claims against them. So one last thought I wanted to share about my mom. I spoke about her case yesterday, and I want to end on this thought. It wasn't just the one nurse who was negligent in leaving my mother's fall prevention alarm off that was on her bed. When I got a digital copy of the medical record, you know, I had already discovered, because I got a paper copy first, and I had already discovered that this nurse had left the bed alarm off, that physical therapy technician had notified her that the bed alarm was off, and the nurse said, that's okay, leave it that way. And so when I got the digital record, I did a word search, and I found out that in the first 4 days of my mom's hospitalization, not one single nurse ever made a notation about the bed alarm. And twice a day, they're supposed to notate that. With each nurse that came on shift, and they were working 12-hour shifts at that time, they were supposed to note the condition of the bed alarm, and not a single one of them over the first 4 days that my mom was in the hospital, did a single one of them do it. Had it not been for the physical therapy tech, who was astute enough to go back to the nurse and say, by the way, I just finished my evaluation and her bed alarm is off. And the RN who was responsible for my mom's care said, that's okay, you can leave it off. So I believe that is a culture of neglect at that particular hospital. And if it's happening there, it's happening across the state of Florida, and it's happening across the country as well. So this is why I believe that some light needs to be shined on these things. Senator Yarborough, I look forward to you addressing these issues, and I hope that you're able to put some language in your amendment that will address the problems with the Department of Health and with AHCA. Because I think that if most people see that justice is done to the person who caused the death of their loved ones, I don't think a lot of people will want to file a lawsuit if they see that the state is taking care of these negligent doctors and getting them out of practicing medicine. Because right now, every citizen in the state of Florida and every person that visits that state is at risk when these doctors and nurses are allowed to practice medicine and practice nursing while the Department of Health is not properly overseeing them. So thank you for your time, and I'm going to go ahead and get this podcast uploaded.